Hello, I'm Viktoria Nagudi, and with me is Kenneth Dillon, a historian and medical writer with Scientia Press. Today, we're going to be investigating the potential merit of gargling as a prophylactic and adjuvant therapy against COVID-19. Now, the Japanese have been employing it for decades, and it's now gaining traction both inside and outside the medical research community. To what extent can gargling help prevent and treat COVID-19, and how should we do it? Now, Ken, there often exists a distrust in non pharmaceutical interventions like gargling. Many associate them with things like old wives' tales. How would you respond?
It's true that gargling is something that is quite easy to make fun of or to denigrate, and there's been a fair amount of that. But if you look at the internet, for instance, and other places, you see basically that there are two main objections to gargling. The first is that where are the clinical trials?
Mhm.
Uh, and in fact, we can now respond by saying there is now a clinical trial that has reported in July. At least reported its data, and I'll get into that later on. And the second main objection is to say that typically when a person catches COVID-19, they do it by breathing in, inhaling uh, a lot of virus, and a fair amount of it gets right into their lungs. And so they have the virus, and you can gargle as much as you want. That virus is still there. And
Right.
so, why gargle? And I think what we have to do to understand that better is to think in terms of the context. And what's the most important contextual point? I think that we have to recognize that respiratory infections are a numbers game. And therefore, we have to think in terms of how the whatever the intervention is can help the immune system to combat the virus. And in this case, we know from an article in the journal Nature on April 1st by German researchers that they found that with a throat swab, on average, on the fourth day of the infection, they got 711 million viral particles. That's really a lot of virus. That's something you can't neglect. Uh,
Right.
Otherwise, it'll go right down into your lungs. You'll aspirate it, and it can be breathed out or spoken out, get out and infect other people and spread around your body. So you can't neglect that. And we have to think in terms of a framework sort of model, and that is the reinforcement model. And that is that the throat can breed a tremendous number of these viral particles in the lining of the throat, and then that they would be aspirated, and there would eventually come to be so many of them in the lungs that they would outnumber the successors of the original dose. So this is really a big problem. Meanwhile, you would be, if you get this infection, you would be infecting other people. And that leads to a very interesting uh, uh, way of thinking about this modality of gargling, and that is it actually has a dual nature. The first is as a kind of adjuvant therapy for yourself. And even though it's not so effective as a prophylactic, as we've seen in COVID-19, but as an adjuvant therapy, it can be quite effective. And at the same time, you are protecting other people. So what you're doing in your gargling is actually prophylaxis for other people.
Mhm.
And therefore, the act of gargling, when we're alone in our bathrooms and tilting up our head like that, that seems like a very solitary act. but in fact, it's a very social act. We are protecting the people around us. And in fact, we all have a kind of vested interest in persuading all of them to gargle too. Uh,
Right.
and that way we'll all be protecting each other.
Right, right. I mean, and it seems that eliminating the virus in the throat can lower viral load and help the immune system kind of like clear the virus by pushing it under a threshold that prevents one from becoming symptomatic. And I believe that, well, number one, you don't want to be symptomatic because you don't want to have a bad case of the virus. But number two, you don't want to be symptomatic because that just makes you even more contagious. So, to that end, it seems that gargling can be useful. Can you elaborate on the evidence in Japan and elsewhere in favor of gargling? What's come out so far?
The Japanese have been, they're the leaders in the world on the subject of gargling, and they've been working at it for more than 100 years, 1918 to 1920, the Spanish flu pandemic.
Every 100 years, it seems like there's a pandemic.
One of the Japanese health authorities' main uh, prescriptions to its people was to say gargle. And the Japanese took it seriously, and they've been gargling ever since. And we can be pretty sure that in the current pandemic, tens of millions of Japanese are busy gargling. Uh,
Right.
and
Sure.
so on top of that, the Japanese have investigated far more than any other country, uh, investigated how gargling can act as prophylaxis against respiratory infections and especially against the flu. And they've published a number of studies, and they generally will show that it is a good prophylaxis. It's not great, but it's certainly in no way defective. It's maybe 20 to 50% of a reduction of risk, so that's very good. And the other thing that they have done is to start thinking about what findings they're getting. For instance, if you look at the problems that they've run into, uh, they don't have an explanation that is very detailed about what actually is the mechanism of action of gargling. And what they do have to offer are some basic attitudes and insights that they've developed over time. And one is that we should be thinking about gargling more in terms of um, disrupting the activity of the virus, of displacing the virus, sort of flushing it out, or in terms of the immunomodulating, rather than thinking of getting the most powerful um, kill ratio antiseptic or antibiotic gargle. And so it's a different way of thinking of things.
Hmm. So I'm hoping that you'll talk a bit about your personal regimen, if there is one. For those who want to take this up as a sort of protective add-on practice, what are their options and what should they do on a day-to-day basis?
Right. I think that we should follow the Japanese lead in this. They have much more experience than anyone
And
else.
everything, perhaps.
And we should know that they have focused on three main gargles in their studies. The first one is povidone-iodine. The second is uh, EGCG, epigallocatechin gallate, which is the main catechin in green tea, and hypertonic saline. They've also done some testing of of other gargles. And so if somebody's thinking of taking this up, and if you want my example for what it's worth, uh, I started when the pandemic began. I started gargling 5 times a day with hypertonic saline, salt water, and I do it for just 15 seconds at a time. Then I swish it around a bit in my mouth. Um, but because I'm doing it 5 times a day, I'm getting a fair amount of exposure to it. Why did I pick it? I picked it for the fact that it's very simple to prepare and use, and it's cheap, and above all, because it seems to have fewer side effects than any other gargle. And
Mhm.
side effects are very important because we're in a pandemic. We're going to be gargling a lot,
Right.
intensively,
And for
and,
a long time also.
and for a long time, extensively. That's right. So we want to make sure that we have the minimum of side effects. And therefore, I think if people are thinking of gargling, they should be looking at these three in particular. And hydrogen peroxide also is a fourth one, perhaps.
Right. I
And
use that. I dilute it with equal parts water
okay,
and gargle with that.
okay. So that's a fourth one, perhaps, that we should be looking at. Why should we not go and try out all kinds of different gargles? Well, there are some concerns about gargles. The first one is that some gargles have had an awful lot of ethanol in them, and that's not good for any kind of intensive or extensive gargling. It's okay for a couple of days, but if you do that regularly for months and months, you're running the risk of inducing oral cancer.
Hmm.
So we should just rule out anything with ethanol in it. And the other two problems are connected with this whole question of the highly antiseptic or antibiotic gargles. Many gargles put themselves forward in that way. And what we know now, and this is not just the Japanese, this is the general understanding of modern dentistry, is that there's a danger with gargles of this sort that you are going to that you are going to um, upset the balance between the various strains of the oral biota, and that can then lead to all kinds of problems, and specifically a study in Puerto Rico, so an American study, showed that if you gargle with various gargles too much, you can uh, have a tendency then toward removing from your mouth the oral biota who are essential for protecting you for the chain of biochemical chain that leads to nitric oxide, which is very important to protect you against something like high blood pressure or a pre-diabetic state. So you have to be very cautious about what gargles you use. And the other reason for steering clear of these high power gargles is that they can induce drug resistance among microbes. So that's a big problem too.
Mm. Yeah, you have to weigh the pros and cons. Luckily, there are a lot of options available, at least, and we have more information on the Scientia Press website also. What about public health institutions? The CDC, for example, have they accounted for gargling, and does the climate differ between institutions?
CDC has been terribly busy, and they've been too busy to come to any kind of idea about gargling. However, they have been approached by the American Dental Association, and they have agreed to partner with the American Dental Association and to have their recommendation that patients coming to a dentist's office will gargle before treatment to protect the dentist, to protect the dental workers, and to protect the patients themselves. And so this is important in two ways. First of all, it shows that CDC has accepted in principle the possibility that gargling is beneficial. And then the second point is a very prestigious and knowledgeable body of professionals, the Dentists of America, have shown that they think that gargling is a very useful practice in this pandemic.
Mm. Yeah, I mean, I think that it's a low cost solution that has little downside if you don't have one of the conditions involved and you're doing your research. So,
Mhm.
um, what about communities? Is it popular, do you think? Within communities here, is the popularity rising? How is the conversation evolving around gargling here and elsewhere among everyday people?
Okay. My sense is that there has been a minority of Americans and people around the world, aside from Japan, a minority, but a fairly small minority that has been regularly gargling since the onset of the pandemic. Uh, in April, there was a flurry of discussion of it, not really a debate. We haven't yet really had a debate about gargling. Too bad. Too bad for us. We badly
Right.
need one. However, it is clear that certain groups of medical people, medical doctors and dentists, are moving forward with gargling trials. For instance, there's going to be one in New York, one in San Francisco, one in Edinburgh. And so there are a number of clinical trials getting started. And, so that shows interest. And then we have the results of a first pilot study, a small
Mm.
pilot study from Malaysia that had 20 participants. They were divided into 4 groups of 5 each. And the first group got povidone-iodine. The second one had essential oil gargle. The third gargled tap water, and the fourth didn't do anything. And on the 6th day, they found that there was complete clearance of virus in the povidone-iodine group,
Wow.
all 5, and 4 of the um, essential oil group, and 1 of the tap water gargling, and 0 of no gargling at all. So a pretty decisive advantage there for gargling versus not gargling or only gargling tap water. Now, that's not a definitive result. That's just a tiny, tiny pilot study, but it certainly is interesting.
Mm.
So we need more studies. Another curious part about it is, it seems to me, although they don't state it because they've just given data, they haven't talked about it at all, written about it. Uh, it seems to me these people probably had upper respiratory tract COVID-19 infections. Uh, so they might have been uh, easier to treat than other groups, and they might have more resembled the asymptomatic carriers that have been such a concern
Right.
in this pandemic, because they perhaps are 30% of the people who have the virus are actually asymptomatic. And so it suggests that if all of these asymptomatic people were gargling, first of all, if they were using one of the 2 gargles, pretty quickly they would have
Right. They would
all the
be
germs would be gone. They'd be
immediate.
free of the virus, so they wouldn't be spreading it. Uh,
That's
so
a good point.
it shows that gargling with this dual nature really has quite some power if everybody does it.
Mm. Yeah, that's a good point. Um, I hadn't thought about that. What other benefits does gargling have that you find it relevant to share with our viewers?
Well, gargling, well, it's a way of showing solidarity. I can tell you one that could be very helpful, and that is, uh, we're involved in coming up to the reopening of the economy
Right, of
and
course.
especially opening of schools. These are terribly difficult questions to handle, and we need all the help we can get. So
Right,
there's nothing stopping teachers' unions from going to CDC and saying, look, we understand you've made this arrangement with the dentists, and so we're at risk too. Our students are at risk, we teachers are at risk, and the staff is at risk at schools. So could you please recommend that we also should be gargling? All of us
right,
should be gargling. And
right.
I think um, that would be pretty interesting to see how CDC would respond. And we have to remember we're in an election year.
Of course. I mean, that's the real virus, elections. Um, yeah, I mean, I think even in another country, there could even be gargling mandates at school. I could see that being effective, but here that's never going to get off the ground, so I wouldn't even suggest that.
But
Um,
a recommendation, that's
right.
good.
Even a
Right?
recommendation could do a lot because there are a lot of people who may have not considered this as an option and who are willing to, have their kids gargle every morning with hydrogen peroxide or something else. Um, it could lower a lot of the viral load in this country for sure. Um, so we've racked through a lot of information in the past 20 minutes or so. What should our viewers keep in mind about this topic, if nothing else?
Well, I think there are two things that I would underline. The one is that we are living in a world in which there are billions of poor people, and this gargling is something that would be something they could manage to protect themselves. And so it gives them some hope and some value, but they have to have a signal about it. And that's why if CDC or WHO or some other prestigious group would recommend gargling, that word would get out pretty quickly, I think, and it could do them a lot of help. And I think the other point that we should be thinking about is I think there's some learning to be done here about science, and that is that um, after all, gargling is not a very dangerous activity, generally recognized as safe, although now we know that if you do too much of the wrong kind, it's not good for you. But generally, you're going to be okay to gargle for a couple of weeks, just about anything. And so the need for clinical trials is less pressing than if you have a drug that might really do some hidden damage. And so it's something we should be much more leaning forward to try to find reasons why we should be adopting this practice. And in that regard, instead of folding our arms and saying, well, I want to see the clinical trial data and all this kind of thing, we need to be taking, scientists need to be taking a more intuitive and theoretical approach.
Right, I
Theory,
agree.
theory can be most helpful when you're in a situation where you only have sparse data, as we are now. Um,
Right, and trials can take months, but if you know that a compound can kill a type of virus and that it's safe to gargle with, then I mean, it just seems to make the most sense to try it out. It can't hurt for the most part.
yes,
Um,
yes, to try it out, and that's there's another part of the science thing, and that is, besides using a kind of theoretical approach with using your imagination and insight and discernment and good judgment, it's also good to look abroad, look overseas, and there are plenty of fine scientists and medical doctors scattered around the world, and we can learn a lot from them if we only pay attention.
mm. Right, I agree. Um, so, and in the past few decades, people have been able to kind of do their own research and come to their own conclusions with the availability of the entire internet at their fingertips. So, gargling, we've looked at it as a practice with apparent historical benefit and increasingly formal scientific validation. We've looked at who's done it, who's doing it, how to do it, and what's being said about it. So, any final points?
I would say it would be, if anyone has a need for further information, it'd be possible to go to our website. We'll put it on at the end of the video, www.scienciapress.com. And there are a number of articles about gargling and that have more detailed information, including some citations to various articles.
Well, there you have it. I've got a dash. It's been 3 hours since my last gargle. But I'm Viktoria Nagudi. This is Kenneth Dillon with Scientia Press, a science and history for the discerning reader.